We'll get started right now. Hello, everybody, and welcome to another session of Dental Shadowing. Today we have Wendy here with us, who's going to tell us a little bit about herself as well as her journey as a dental assistant. So Wendy, you can take it away whenever you're ready.
All right, thank you, Hannah. Hi, everybody. My name is Wendy, like she said, and I am a dental assistant. So we're going to learn about the journey of, what a dental assistant does on a day-to-day basis and how to get there. You can go to the next one. All right, so I am a first-gen student. I will be the first one of my siblings and my entire family actually to go to college. To become a dental assistant, I actually went to Everest College. Citrus Community College, where I got my associate's degree in biology, and I'm actually doing my undergraduate right now, currently at Cal Poly Pomona. Fun facts about me is I love collecting funky socks. I'm a boba addict, and I love Grey's Anatomy. And then in the pictures, we go back really quick. On the pictures, we have just my parents and my niece and my nephew and my fiance there. Yeah. All right. So why dentistry? This is actually one of my favorite quotes. So in life, you have the freedom to pursue whatever your heart desires. Since I was little, I knew that I wanted to be some kind of doctor. I just didn't know, obviously. So as I was growing up, junior high and high school, we started looking at careers and researching more and more. Then I finally decided that dentistry was what caught my attention. Once I realized that that's what I wanted to do, I started looking more and more into it. And I decided that I wanted to become a dental assistant first and foremost because I wanted to get my foot in the door. I wanted to know what I was going to get into and if it was really going to be all worth it in the end, instead of just going straight to college and not knowing that this was what I was going to eventually end up doing. So that's why I chose dentistry. So a dental assistant, unfortunately, is not just sucking up everybody's saliva all day long. There's various tasks that come along with it. There's two types of dental assistants. So there's front office and back office. I am back office. I've never liked front office. I did it for a little bit, but it was not my thing. So in the back office perspective, we have a lot of clinical tasks, which is obviously assisting the dentist, patient care. So, finding out why they're here, what can we do, make sure they're comfortable, taking x-rays all day long, every single day, taking dental impressions, fabricating dental appliances, setting up the rooms, things like that for the doctor, assisting, sterilizing instruments, and just making sure that everything in the office is ready to run for a smooth day with the doctor. So how do you become a dental assistant? So in the state of California, there's 3 different ways that I know of. First, there's certifications. So if you go to a trade school or vocational school, and that program's usually 6 to 9 months on average. You can also go to, I know there's a few community colleges here that have the dental assisting program. You can actually get your associate's degree in dental assisting or oral healthcare, something along those lines. And that's about a year to 2 years. You can also do supervised training, which we have done in the past here in our office. And here in the office, let me pause real quick. I've been with this doctor for 8 years, so we've done a lot together. We've trained people that have not gone to dental assisting school at all whatsoever. 2 of those people are actually my family members. So it was an interesting experience, but they're not the only ones. We have various other people. So under supervised training is actually the best. So if you guys out there can find someone that's willing to do that for you, one, you're going to save money and time because you're going to be able to be working on your own schedule rather than signing up for school, getting yourself into some or little debt, right? So if you guys really find that, it's a precious jewel. So I wish you guys can find somebody for sure. So how did I become a dental assistant? I actually went to trade school. Being a first-gen student, I didn't have anybody to guide me through college or what was the way to go, or I didn't have a dentist that I started talking to or anything like that. So I did my own research and I found that I was gonna go to the trade school because again, it's only 6 to 9 months, and I'm like, what's 6 or 9 months, you know? So that's how I did it. In order to become a registered dental assistant, just like in the nursing or medical field, there's nurses, and then there's registered nurses. I'm sorry. There's also registered dental assistants, and for that, you also need to take some examinations, some state board exams. So if you take the board exams, then you can become a registered dental assistant. Otherwise, you're just a dental assistant. So a typical day, I love little memes, so you guys will see some on my um, presentations here. So like I said earlier, unfortunately, it's not just, suctioning saliva all day long and making sure your patients don't choke. So basically, what a typical day for me is, we come in, we open up the office, we make sure that all the instruments are ready to go. We confirm cases, and by cases, we mean that like if someone's going to get a denture, a crown, or whatever, we make sure that it's actually here for them for the day. That way we don't, accidentally the patient show up and we don't have it for them, then we're like, oops, we don't waste our time. We also make sure that the rooms are set up. We'll clean them up after every procedure, obviously, tidy up the office during the day because it does sometimes get kind of hectic. There's days where we can see up to 40 patients a day, which that's a lot for a dental office. Our office is actually pretty big, so we're busy. We also talk about finances. We collect payments. We assist doctor all day long. We have a hygienist in my office, so we would also be assisting her throughout the day. We restock the rooms. We restock the office. Anything that needs to be tidied up, again, we'll go ahead and take care of that. We also make whitening trays in my office, and we make knife guards, where a lot of offices usually send them out to laboratories, but we're lucky enough to have those machines here. So we do actually do that as dental assistants. We also pour the impressions that we take on patients. So those impressions will eventually turn into a night guard, a whitening tray, or just go out to the laboratory for any prosthetic that needs to be made for them. We'll also call the labs to come and pick up the cases, make sure that they show up on time, bring things on time, things like that. And our hands on deck, this is literally a small list of what a typical day looks like, but there's so many things that need to be done and taken care of. And with the experience, for myself, like I've been here for 8 years and I've worked with the same doctor for this long. Our relationship is a little bit different than someone that has just 1 year of experience or less. So I have more duties all day long. There's interns that come in, I train them, I teach them. There's new employees that we get, new assistants. So I have to make sure that I train them as well. Or I get on the phone and I'm talking with patients about, things that weren't clear or something. But I have a lot of other duties. And this, like I said, is a short list of what a typical day usually is. So just depending on your experience and what your boss allows for you as a dental assistant to do. Because some of these things that I do during the day aren't typical for a regular dental assistant. I do things that an RDA does, just because, again, I've been here that long and we've built that trust together. But also my colleagues that haven't been here for 8 years, they are doing duties that RDAs actually do. But it's just the type of office that we work for. So that's what I mean by all hands on deck as well. Yeah. Some common procedures that we do here, I actually didn't mention this, but I work for a general practice. So we do a little bit of everything. This doctor does everything. Unless it's a special case that he needs to send to a specialist, then we'll refer them to them. But some common procedures that we usually do all day long here, again, x-rays. There's some x-rays that are called bite wings. There's some that are called panoramic. There's periapical. Prophylaxis is a prophy, which is a simple cleaning, quote unquote. Scaling and root planning is the short word for that is SRPs, and that's like the deep cleaning that every person knows. So basic cleaning and deep cleaning, root canals, crowns, implants, braces, veneers, composite restorations, which are also known as fillings. So these are just some of the common things and also some of the procedures that we do here in the office that I work at. 1 second, it froze up here. Okay, so the type of practices that you can work as a DA, I honestly, you can work at any kind of office. But you can also work for specialties, which is orthodontics, and those are like the braces doctors, oral surgeons, endodontics, which are the root canal specialists, periodontists, which are gum specialists. Usually, most of these places, if you've had some experience in general or in the field, they'll hire you. But some places, if you don't really have experience, you need some extra training. So you'll need to go to school or look up some programs that are offered and just get certified for that specialty in particular. But for the most part, all the doctors are willing to take you zero experience. You can also work. Oh, go back. Let's see. Yeah. So I've myself, like I said, I've been with this guy for 8 years, and it's general practice. But when I did my internship for my program, I did work at a corporate owned, which is a whole other animal. It's very different because they don't really have like an set boss. You know, there's someone higher than the doctor that's actually wanting the place to run. So it's a little bit different. So you asked me which one do I prefer? I prefer a private owned because it's just a different atmosphere than a corporate. It's almost the same as like working for a McDonald's and then working for like a mom and pop burger place, which is going to be a little bit less stressful, right? So that's my opinion though. So dental assistant versus hygienist. Yeah. So dental assistant, like I said, we have a lot of clinical duties. And yes, a dental hygienist also has a lot of clinical duties, but they're a little bit different. We are doing the dirty work, if you will. So like I said, we take the impressions, we take the x-rays, we deal with the patients. I want to say the 90% of the time that they're here for their visit. The hygienist, she is, or he, they're someone that works with the patient on their gum health overall, right? So they work close hand on hand, making sure that they know how to floss, brush, and taking care of their teeth and cleaning it for them. We as dental assistants, unfortunately, we don't get to clean anybody's teeth. So that's kind of the main keys difference between a dental assistant and a dental hygienist. All right, so what it's like when a patient comes in, obviously they check in. Once they're at the front desk, they'll get asked if they have any finances that they need to get taken care of. They'll collect their payment. Once that is set, then they're ready to be taken back. So we'll bring them back. Once they're in the chair, depending on what their visit is for, they might be here just for a quick, follow-up appointment because they had a tooth extracted or whatever. We will take care of that. But if there's x-rays and things that need to be taken care of as well, we'll go ahead and take care of it before the hygienist come in or the doctor comes in. We'll also make sure that they're comfortable. By that, I mean, like if you know it's a patient that has, they're anxious to be here, they've had a bad experience, like we just want to do whatever we can to get them comfortable for first and foremost. And then in our office, we actually have TVs in the rooms. So we will offer them like a movie or Netflix, something to drink, anything to just help them relax, some music, some headphones, whatever. Once they're done with their treatment, we in my office will schedule them their next appointment. There's other offices where you'll walk them out and the front desk actually takes care of that for you. But in our office, us in the back, the dental assistants, we do that. And then we'll go ahead and dismiss them and that's it. So right here, this is actually a case that Dr. Desai did. So this is actually from my office. Sam here, she had some gaps in between her teeth. So we did a smile makeover on her with some veneers. With this, we basically were able to close some gaps, give her bigger teeth, nice white smile, and she was really happy actually. And it actually came out pretty good. So this is a procedure that Dr. Desai does on a regular basis. We do them, I don't know, maybe 2 or 3 a week. And it's just awesome. It's awesome giving somebody a new smile, definitely. You can go to the next one. This one is implants, and this is actually on my aunt. She had a couple of bad teeth, so we ended up taking care of it for her. On the lower part, you can see where we pulled out a few, all the remaining of her teeth, because she had a bunch of bone loss and her teeth were loose and stuff like that. So for her thing was she didn't really want a denture because she was scared that it was like gonna flop everywhere. So we gave her the option of an implant supported denture. So we went ahead and planned out for it. And she actually got those 4 implants on the left-hand side. You could see that we placed those for her. And the picture on the bottom right, this is a software where Dr. Desai can look and see and plan out where the implants are going to be placed. So that's what we did for this patient here. Another thing that we usually do all day long, this is more common than anything, extractions, which are pulling of teeth. And here there's a couple of pictures. It's all different patients that I just took with my phone on Snapchat and stuff like that. There's this one on the left is actually pretty cool because it was a wisdom tooth with 4 roots. And usually molars have 3 roots, so it was pretty cool to see that. On the second one, it's actually a pretty juicy picture because that one actually has like some gum stuck to the tooth. So I loved it. The next one had a really big cavity on it. You could see that. And then the last one's just a tray of like how the crime scene looks after we're done, pretty much. Yeah, so I've been a dental assistant for 8 years. I'm going on 9 here in a couple of months. But I love it. I love that I chose to do this before getting myself into the field, like I said, because it's given me the opportunity to grow professionally and also just gain a lot of experience. Like I feel that on a day-to-day when things get hard in undergrad, I'm like, dude, I already got my foot in the door. I know how it's gonna be. Like, I shouldn't be as nervous. So it just gives me a lot of confidence, knowing that if I become a dentist, like it's gonna be a walk in the park because I already know how to deal with patients. I know how to talk to them about treatment. I know how to talk to them about finances. And more than anything, it's made me become ambitious because I love dentistry so much. It's like I don't just see myself as a dental assistant. I don't want to just stay here. I want to continue growing. And so I love it. All right, so I actually wanted to show you guys the office, which is why I decided to do the presentation here. So just show you guys a little bit, some equipment, what our office looks like and operatory things like that. So give me a second, let me get this unplugged and we're gonna go take a look. 1 second. All right, so this is actually the front office. We just moved here. Dr. Desai has been a dentist for 15 years. We were down the street, so we just moved here. We built this from scratch. And that's another thing that I love about having to been working with him for such a long time because I've seen him start from the beginning to build this beautiful practice that he now has. So it's awesome. And it's actually about 1,300 square feet. We have 8 operatory rooms, so we can see 8 patients at a time. Let's see here. So once they come in through the front, right, they come into the door here, and then we go into the operating rooms, which this is one of them. Right, and we have the, like I said, so here's another one, and then we have here the X-ray room, one of our X-ray rooms where we have a panoramic machine. So this machine will take like a full X-ray of their entire mouth. And it also does a couple of other fancy things like a CT scan. But like for the instance, the picture that I showed you guys for the implants, we do that here with this machine. And then this is our lab. It's actually kind of a mess right now because Friday and Saturday was crazy, so we didn't finish cleaning it up. But these are some of the things that when we like educate a patient, the dentist prescribes, diagnoses that they need, some kind of treatment. We'll use like little models to show the patient exactly how procedures will go or how things will look. I like this one. This one's like the implant one, so we can show them how it is. And it's actually the 3 process too, right? So we actually put the implant, then we get this guy on here, and then lastly they'll get a tooth on there. So I like those. We also have like let me see here. Dentures or partials. Sorry, this is a partial. So we show a patient if they need one. what it would look like, what kind they would like, and things like that. Bite guards for those grinders. We also make them here. Um, we have the special machine to make the bite guards here. And with this machine, we can actually make whitening as well, or retainers. And then this is another, it's kind of more old school, but we use it to make the whitening trees as well. And then actually on Saturday, I poured up some models. Then this will actually turn into a night guard as well later on. Let's see, what else do we have? Oh, we have the sterilizing machine, which is called an autoclave. So here is where we'll run the instruments all day long, get them ready. And let's see. Yeah. Then it's in the cabinets. We just keep everything organized or somewhat. Don't judge us, okay? Like I said, the whole weekend was crazy. So we just keep everything in place, everything in stock. And yeah, that's all right. There's one more thing. My favorite thing, the implant cart. So this is all the equipment that we'll need for doctor to place the implants. Here are some of the drills, actually. Some of the drill heads that he uses. And this is to basically drill into their bone. Sounds scary, but it's not. So that's a little bit of our office and equipment that we have here. Let's see. I'm gonna go back over here. I didn't show you guys all the rooms because they're technically the same thing. It's just their lab that's a little bit different. Okay, I think we have a few more slides to go over. Okay, so like I mentioned earlier, I decided I wanted to become a dentist because I'm a go-getter and I don't believe in just settling where I'm at. One, financially, two, professionally. So who doesn't like money, right? So I'm not in it just for the money, but definitely could see myself growing. I'm passionate about dentistry. Like I said, it was something that I wanted to do since I was young. And thankfully, because of the route that I chose, I can definitely confirm that this is what I want, and it's definitely for me. I want to make a difference, break the stigmatism, that uh, Hispanics can't make it this far or whatever, la la la. But not only that, I also want to make a difference for my family. I don't want to be the only one that goes to college. Like I showed you guys my niece and my nephew at the beginning. I want to be an inspiration for them. I want to push them to become somebody, and hopefully inspire others, not just my family, really. Advice. This is my favorite little quote picture. I have it on my social media. It's been for years. A journey of 1,000 miles begins with a single step. So, advice. Yes, it may seem like it's a long journey, even if you decide to do dental assisting school first, which not everybody has to. Like I said, if you get lucky, cool, somebody will train you and you're on your way. But for those of us that aren't lucky, yeah, it's gonna take a little bit longer, but like it says here, every journey begins with a single step. So do a little bit at a time. Don't be so hard on yourself. And even though it seems like you're never gonna get there, you're doing something every single day to get there, and every day is progress. I would say keep chipping away at it, and stick to it. Even though, like I said, it gets hard, blah blah blah. Mm, like for me, even though nobody at home has understood what college is like, it can get hard. Just keep pushing. That's all I have as a piece of advice for you guys. And some questions.
All right, so we have some questions for you. The first question was about how you mentioned you went to trade school to be a dental assistant.
Mm-hmm.
How long was it? And can you tell us just like a little bit about it?
Yeah, so for me, my trade school program, at the time when I went, it was 6 months, the program. In total, it was 9 because it was 6 months of just school and training and 3 months of internship. So 9 months. As far as telling you about it, it's just a bunch of dental related things. You don't take like biology courses, nothing like that. It's just teaching you really all hands-on and terminology and procedures. But it's not that tough if that's what you guys are wondering. It's not tough at all. Um, yeah.
And then another question for you is basically about how your dental school application will look like. Do you think it's a benefit of having experience as a dental assistant for your dental school application?
Definitely. I'm new in the social media thing, so as I'm gaining friends and looking and networking, I see that a lot of people do have some kind of dental experience, but I haven't met anybody that has as much experience as me. But I feel like a lot of people have mentioned that because they had that experience, it did help them a little bit. Obviously, that's not going to be the only thing that's going to define my application, but it's definitely going to be a big plus.
And then also, I know you mentioned about being a current student at Cal Poly Pomona.
Uh-huh.
Have your like credits been able to transfer over so that you kind of have like more of a head start into your courses?
From the dental assisting program.
Yeah.
Well, no, because like I said, that course, the one that I took, it's nothing to do with biology. So no, none of those things have transferred over. I did get my associate's degree in biology at a community college, and yeah, that transferred over. But no, nothing of my dental assistant program transferred. Like I mentioned, I do train interns here that are coming from the associate's degree dental assisting program, and I think recently here we had one girl. Some of those classes do transfer because they do take like some biology courses. So if you go that route where you don't do trade or vocational, and you go to the associates, so you might have some classes that transfer when you go to your undergrad.
And then someone asked in the chat, what is something you would tell your younger self going along your pre-dental journey?
um, let's see. Again, I just nothing, just keep pushing. And I would tell myself like you're gonna be somebody big, just keep chipping away at it.
And then do you plan to specialize or just be a general dentist?
I do want to specialize, but okay. Prior to COVID, right, and all this situation, I had just gotten engaged, and we were gonna have our wedding last year, but COVID messed things up. And I am getting a little bit older, so I we'll see. Once I finish with dental school, we'll see where we're at with life and how marriage is going and home and all that. But if I would specialize, I would definitely look into endodontist, so root canal specialist.
Awesome. And then another question for you. What is your favorite part of being a dental assistant?
My favorite part of being a dental assistant is definitely making the change in somebody's day. So it can be like, someone that hasn't had a cleaning in a few years and they come in that day and we, take care of their cleaning and then they feel good about themselves afterwards. After they come back and see the results and they're like super happy and they're like, oh my God, I can't believe that I've denied it for such a long time. Like that to me is a relief. So just changing their day, even if like they come in and they're having a bad day and their day just got better because they came here and because I was the one that assisted with them and talked to them. That's my favorite part, honestly.
And then another question. I know that often dental assistants are the ones running around and doing a lot of work.
Yeah.
Do you ever find any cons or a lot of stress from certain things of being a dental assistant?
Stress. I don't know. I don't know so much stress. Sometimes yes, it just depends what's going on outside of here because like I am an undergrad and I can be having a stressful situation with school or where I have so much homework and then coming here and it's like we're unorganized or things aren't going the way you're going. Like yeah, it can get stressful, but is it a stressful job? No, and it's not going to be a stressful job if it's something that you really like. And since I love it, it's like I could be mad or have a bad day for a couple of seconds and then get over it because I love being here. And I could be having a bad day at home and come here and it's like I'm having an amazing day.
Another question, if it's too personal, you don't have to answer, but do you think that income-wise, working at certain offices, it's different, like money-wise?
Definitely. Um, well, let me tell you guys, it varies on the area that you work in, right? Well, I don't know where everybody else is based from, but I'm in California and it varies on the city. So if you're like in downtown area, you're gonna make a lot more money. It can be a bougie office, it can be fancy office, and you're gonna make more money. Obviously, in a different kind of community, you're not gonna make that much. You might get lucky and find somewhere where, yeah, you're making a lot because the patient variety that they have is good. So, I mean, and also if you work for specialty, that's for sure you're going to make more money than a regular dental assistant in a regular little mom and pop office. And like I mentioned earlier, corporate, that also there's more opportunity for income growth there.
And then if you had to go back, do you think that you would have started your pre-dental journey more early, or do you like the route you've taken?
Um, well, we didn't talk about all that, but was going back to when I was like in high school. Yeah, I knew I wanted to be a dentist, but at the time, how things were at home, it was more like I'm not gonna go to college. I'm just gonna work and help out my family. So would I choose a different route? Yeah, I just wish I wouldn't have decided that I wasn't going to go to college so that I would have been a better student in high school and wouldn't have had to go on to community college first. So that would be the only thing. But other than that, I mean, I like my journey. I like my decision of going to dental assisting school first and getting my foot in the door.
And then another question for you is, how has your first generation Latina background played a role in your journey?
It's just kept me motivated. It's it's something that pushes me every day. And like I said, since I'm new in social media and I'm seeing like other Latinas and Latinos in the community also doing the same thing as me, I'm like, hey, like I can do that, you know? And even when I sometimes at school feel like I don't belong, I think about that and I'm like, wow, I made it far. I'm not the only one, so I know it's something that's possible. And like I said, since I am first gen, I just feel like if I do this, like my parents and my family are going to be proud of me, and the next cousin or sibling or somebody will continue the journey as well.
And then another question, people are asking a little bit about how you said that you can actually be a dental assistant, like if you come into an office and they train you. How would you go about that, asking a doctor if they're able to train you?
Um, I'd say if you know somebody that is already a dental assistant or works at a dental office, talk to them. Ask them like, hey, is there opportunity there at your office? Like, is your doctor willing to let me come in and shadow? You know, just by shadowing, and if you're not in their way, or the doctor just likes how you look or talk or whatever, he might offer you an opportunity. Going back real quick to that, like I said, I trained one of my cousins and I brought him just to like shadow or to help us out. And at the end of the day, the doctor was like, hey, can I talk to your cousin? And I was like, yeah. So he ended up talking to him. They come into the office, and well, it turns out that my doctor had offered my cousin a job, like I said. So if you can just find someone that's there, and even if you don't know anybody in the dental office and you're cool with your dentist where you go, like talk to him, tell him like or her, can I shadow you? Can I is there a way to get in the door, even if it's just you sterilizing instruments? Because we've had people where we hire them just to do instruments, and then we end up having them cleaning rooms, helping us assist, things like that, and that's how you can get your experience as well. So don't be scared to ask. I mean, the worst thing that can happen is them say no, and there's literally like at least 10 doctors or dentists in the same street that you're already asking. So don't be afraid.
And then I know that the journey to becoming a dentist is long, as well as, you know, the pre-dental journey. What would you say to those who are scared to pursue that just because of how long it might take?
Like I said, just try. Um, it's long, but it's worth it. and just the satisfaction that you're gonna have at the end, like it's gonna be worth it. And for me, like I said, I was able to see this doctor grow, especially from the bottom to where he's at now. And it's just I'm like I look at it, I'm like, yeah, it's gonna be worth it, even though when it's hard.
And then a lot of people mentioned, can dental assisting be a little bit repetitive, and how do you get the best out of every day?
It can be repetitive, but every day is different. Like every patient is gonna be different. There's not grouchy patients, there's good patients, and that's how you make the best out of it. Seriously, like you can have somebody that comes and they're just a complete jerk, even when you're assisting, and even to the doctor, like they can be rude, but it's just fun. Like I don't know how to explain that. It's You're not going to get bored of it, honestly. You're not. Every day is going to be different. Yes, it's repetitive. Your duties are repetitive, but the clientele, the patient wise, like it's going to vary, and every day is going to be different. Not every time that he extracts a tooth is going to happen the same way for the next person, or, you know, it's just good. It doesn't get boring, I promise.
And then are the requirements for the front and back office dental assistants the same?
Yes, they are. They just have different duties. They focus more on like calling insurances, confirming patients, dealing with doctor because he, like what's going on here, why isn't this patient showing up, things like that. More administrative. So the schooling and everything is the same.
Okay. And then would the front office also be in charge of like making appointments and things like that?
Yeah, they in an ideal place, they're the ones that do it, but our office is very different to other offices. So we actually, dental assistants in the back, take care of that. One, just so that the front isn't so cluttered, because our office is pretty busy. Like I said, we see up to 40, 50 patients a day. So we take care of that for them in the back. The front isn't cluttered while the other patients are getting checked in and their finances are getting taken care of.
Awesome. And then our last question for
Yeah.
you is, what is your favorite procedure to perform or assist in?
I actually have two, not one. I love implants when he places implants. It's interesting. It's bloody. It makes my mouth water. I know that's weird, but it really does. Like, I love creepy things like that. I even told him like before, I'm like, oh my God, is it weird that my mouth is watering right now? He's like, you're a weirdo, but I love it. Implants for sure, and root canals. Root canals are awesome too. They're long and boring. Not everybody likes them. So everybody here in my office knows that like if there's a root canal, like Wendy wants it. So yeah, those are my two favorite ones.
And then actually we have one more question. Can you tell us a little
Yeah.
bit about the implant process?
Sure. Like I said, it's actually a three. What do they want to know? Like how the treatment is or how it goes?
Yeah, like kind of like how all you guys work together to do it.
So basically, for that, for most procedures, it's only the doctor and one assistant. For this procedure in particular, for implants, it's three of us. So two assistants and him. Um, One will be suctioning the blood, and the little machine that I showed you guys for the implants, it spits out saline water. So that's what the other assistant will be suctioning. The other one will be behind doctor getting the next files ready for him so that he can continue drilling on the bone. Because most of the time he's when he's placing the implant, he's not looking up because it's just like it's a delicate procedure. So he needs to be like focused. So the person behind him is handing him the drills, and then once he's ready for the actual implant, we'll hand it to him. And that's how it is. And it's actually really quick. It's like for doctor, he's been doing implants for a while now. So for an average of just one implant, it's like 10, 15 minutes at most.
Awesome.
Yeah.
All right. That is going to conclude our session. Thank you so much, Wendy, for coming and talking to us today about your dental assistant journey and also your journey to becoming a dentist.
All right. Thank you guys for having me.
And you guys, I think Wendy is also open to any DMs or questions you guys have. So I've linked her Instagram here at Latina Predent Diaries. And then the post-session quiz will be in our Instagram